You know life has its ups and downs. Turn your pretty face to an ugly frown. Seems that when I fix one thing.
Hello, welcome to The Awakening. I'm your host, Angela Brown. Today's topic for discussion is dental health, and I have Dr. Marai sitting here with me, and I think he's a very good doctor. We just met for the first time, but I've got lots of good feelings about him from various people he's worked with. So if you sit back for the next 30 minutes and wait, and we're going to give you a show you won't want to turn off. Welcome.
Thank you very much, Angie.
I'm so glad to have you here today. How are you?
Great.
Okay, tell me first a little bit about yourself. Are you married?
Yes.
Okay, children?
3 girls.
3 girls, okay. And
So
you
I have
live
4.
5 what?
So I have 4 girls.
You
The
have
wife
four-
and 3 kids.
Oh, the wife and 3 kids. Okay. So what made you, or what made decided for you in your head to go into dentistry? I want to know that question first.
Well, actually, when I was in college, one of my roommates, his dad was an oral surgeon, and I used to visit him. And I looked at oral surgery. I thought it was phenomenal.
What
And,
was phenomenal?
well, the procedures he were doing and reconstruction and things like that. And actually, I was trying to go into medicine at that time. But then when I saw the way he worked and the type of procedures he did, I said, this is what I want to do. But he said, you gotta be a dentist first.
Oh,
So you have to go to dental
okay.
school. So then when I finished dental school, I went into dental school, I did a lot of surgery, and then I kind of like, I don't want oral surgery anymore. I want to do everything.
You want to do it all?
So I went to New York for a 3-year advanced program, and basically I wanted to practice dentistry like a specialist in every
Right.
area. So that was cool.
Okay, we're going to discuss diabetes for a few minutes. Is that okay with you?
Great.
Is there any connection between diabetes and oral dentistry problems?
Well, there diabetes and gum disease. You
Well,
really
let me go back. Is there a relationship between diabetes and gum disease?
Oh, yes,
Let's
yes.
start with that one first,
Uh-huh.
okay? I'm sorry.
you really can't separate one from the other.
Why?
Well, let's say you have a diabetic with poor sugar control, and they have gum disease. In a situation like that, on looking at it from the diabetic viewpoint, you have sugar fluctuations and
Up and
bacteria.
down.
Right,
Okay, okay.
and bacteria need sugar to multiply.
I did not know that.
Oh yeah, so they have a ready supply of a lot of sugar from
So
the
then when you go to bed at night, your kid should not have a lollipop or something to go to sleep because it can work. The sugar can work on the
Well,
gum.
you need that. You need to don't have the lollipop. The sugar is still in their blood anyway, and
Really?
it's delivered to the bacteria in the mouth by blood vessels. So whether the diabetic is actually actively eating or not, sugar levels in the blood the sugar is delivered to the bacteria by the blood system. So they multiply in huge numbers.
Right.
And looking at the other side of it, well, chronic gum disease disrupt diabetic control, meaning the bacteria produce a lot of toxins, numerous toxins that decrease the efficacy of the diabetic's drug. So it doesn't work well. So the diabetics control of the diabetes of the diabetic condition is difficult because it's being affected by toxins, by bacteria. So you see, it's a relationship between
The
the two.
relationship, yeah, one can kill the other.
Right. You have to break the cycle, really. You have to arrest the gum disease to get a diabetic to become better control.
Now, what was that arrest?
Well, you can't really eliminate gum disease. You can
No, you can't.
You can
No,
arrest it.
Yeah.
Yeah. If you once you bring it under control, diabetic control gets better.
Okay.
Really?
Yeah. And the person lets up on what they're eating. Now, I knew someone had diabetes, and they was always eating cakes with white frosting and strawberries.
Well, nutrition plays a huge
That's
is
the
a
next
huge
question.
factor.
Nutrition, what you
Yeah.
put into your mouth.
Yeah. Well, the thing with diabetics, simple sugars will be the problem, like candy, cakes, donuts, Sugar, anything that juice, anything that has sugar.
Juice has sugar. Okay, orange,
yes.
regular orange juice?
Juices, sodas, high fructose corn syrup. Sugar is sugar.
Oh my
So
God.
all simple sugars cause a rapid rise in the blood sugar level. Okay? So in a diabetic, what diabetic really should do is eat more like complex sugars, like whole grains.
Whole grain cereals, whole grain bread.
Well, cereal also often has a lot of sugar in it.
I love shredded wheat. Does that got sugar in it?
Yes. try the sugar-free one. But
Okay.
what I mean by whole grains is like brown rice, barley, chickpeas,
Pasta.
beans. But pasta is actually can also raise your blood sugar level rapidly.
So what do we eat? All the things I like.
You have to try all the whole grains. And you really have to, if you eat that way, you can actually control sugar levels better. And also, you know, you don't want to starve the bacteria really. You don't want to deliver back readily available sugar directly to them. You want to starve them out. So if you change nutrition, the diabetic changes nutrition and eat more whole grains and stop all the simple sugar diet, that would be one step.
That's going to hurt a lot of kids, though, isn't it?
Well, kids.
Yeah, I'm thinking about the ones at 3, 4, and 5, you know, because...
Yeah. Well, in a case like that, what you want to do is, let's say the kid does eat candy or wants to eat something sweet. Just rinse in the mouth right after eating something sweet will knock out 90% of bacteria that has multiplied in that instant.
90% if you rinse out your mouth
Right away.
after you have eaten something sweet.
Yes.
You can knock it out by 90%?
90% of the bacterial growth. You see, bacteria grows very quickly when you're exposed to sugar and produce acids that affect, like cause cavities and things like that. If you want to reduce the bacteria count very, very quickly, right after eating something sweet, rinse with just plain water.
No Listerine or stuff like that?
Well, you can use Listerine
Little kids
too.
don't like that, because I have a great niece who's 8 years old. When she comes to my house, she knows you're going to brush your teeth, you're going to rinse your mouth, and then you're going to use some Listerine.
Well, sometimes the alcohol, it might be too strong for them.
Well, then I bought some of that stuff that you put on infections. Oh, what the heck is it called? It's foamy stuff you put in your mouth to rinse your mouth out with, and she likes the taste of that better. But I'm a fanatic when it comes to teeth. Oh my God.
Try to stick with the water. It'll work
The
good.
water works good? Okay. Now, if a person is, let me see how I'm going to put this. Is water better to rinse your mouth with than some of the stuff we buy over the counter?
Absolutely.
Okay.
A lot of mouthwashes are as effective as water. They just have a cosmetic effect, really.
And what do you mean by cosmetic effect?
Well, the minty taste or the feeling of feeling, it feels, the bread feels good, the minty bread and things like that. It's all cosmetic. Really, just water is fine.
Okay. Now, I'm going to get a lot of phone calls about this. That's why I got to ask you, what kind of cereals are best for children to eat? Because I have a great niece, and I want to be sure she's eating the right stuff.
Well,
you just said shredded wheat's got sugar, and that's my favorite cereal.
most children will pick a cereal that has sugar, and that's their favorite. And the one with the multicolors and all these things.
Oh, yeah.
All those things have sugar. And really, the ideal cereal really should have no sugar in it.
The idea is oatmeal?
Oatmeal is fine.
Oatmeal is good. I can eat that. Okay, oatmeal. I love oatmeal.
Oatmeal, you can sweeten the oatmeal with raisins. And if you use oatmeal, don't use the instant type. That's a lot of simple sugars
I
will be
use the stuff you
created.
cook.
That's the whole grain.
I'm doing something right.
Yes.
Okay. And how about milk? I don't think milk has a lot of sugar in it, does it?
No. Well, milk has some type of sugar in it, but that's okay.
Okay, what about the kinds of meat? What about hot dogs for children? Because I know they love hot dogs.
Well, there's preservatives in there that often have sugar too, and salt. So, but that's not a readily available source of simple sugars like eating a donut. So I guess that's
so
like
cinnamon buns are so good too.
Right. And well, of course, donuts.
Be honest, do you ever have a donut?
Sure.
Oh, give me 5. I'm like that.
Rarely, but I do. But if
I
I
do the same. I cheat.
yeah, I know the rules. I have
know
to
the
go.
rules,
I have to go
okay.
rinse out. You know, some people with gum disease, you go and eat something sweet like that, you're gonna have a rapid growth of bacteria in the mouth right away.
Now,
Literally.
bacteria, what are you talking about? Something that grows in your mouth like a fungus?
Germs.
Okay, germs, okay. That's just as bad as picking something up off the street and putting it in your hand and putting it back and then putting your hand in your mouth.
Well,
Kids do that all the time.
yes. Well, these type of germs that cause gum disease are a specific type of germs, and they also cause other infections, other problems in the body too, not
Like
just
what?
gum disease. Well, pneumonia is one. You know, I was watching a show with Dr. G, medical examiner, it's a pathology show, and it was showing a 43-year-old man that died from pneumonia.
At
And
43?
yes, what happened to him, he had severe gum disease, and he really inhaled the bacteria from his mouth right into his lungs and got pneumonia. That's called,
That's amazing.
right.
That's amazing.
And you only have like 5 days to live if something like that happens. So it's called
5
aspiration
days.
pneumonia.
Yeah.
Yeah. Now there are other things that gum disease can cause, like there's a recent study actually about a young mother that had a 9-pound stillborn baby. Yeah. Now she had advanced gum disease. So
The doctor didn't know it?
well, no, but the medical doctors often don't check for gum disease.
I think all pregnant women out there will do after you hear this
Absolutely,
today, because this
absolutely.
is serious.
Right. Actually, the bacteria traveled from her blood system to the fetus and destroyed every organ in the baby's body.
Oh my God.
Right. So pregnant women especially should check for gum disease. Sometimes they can get confused between gum disease and gingivitis, which there's a difference there. Pregnant women do have gingivitis frequently because of hormone levels,
Yes.
changing in hormones during pregnancy. But they don't want you, and it's exemplified by bleeding gums.
Okay.
But when you check with a dentist, he might find gum disease instead, which is really bacteria living under the gums that destroy the bone.
Okay.
And,
Then you
you know-
get bone loss, you're in a problem there.
Well, as you have more and more bone loss, the teeth get loose and you have to take them out if there's no treatment.
But a mother who eats too much sugar and doesn't really know it and mentions it to her doctor, she lost her child.
Well, in that case, that mother, it wasn't necessarily sugar, it was just basically advanced gum disease in the mouth.
Advanced gum disease.
with
How do you
bacteria.
know you got advanced gum disease? When you chew, do you bleed, your mouth
Well,
bleed?
the question
Let's
is-
get to that point. This is interesting.
You can tell somebody has gum disease by signs and symptoms. Like one, the classic one we talked about is bleeding gums.
All right, that's one.
Yes. If you brush your teeth and you see blood, there's a problem. You should never, ever see blood when you brush your teeth, ever. Bad breath. That'll be the second one. Loose or drifting teeth.
Loose, you mean your teeth start to slide?
No, sometimes you see the teeth start to move and drift over time. They seem to be spreading apart or coming out this way. That's a very good sign that you have gum disease and bone loss. That happens with gum disease. Other things, gosh, you have some people who have partial dentures. One day they might fit, next day they won't because the teeth are moving. Okay? Some people, something changing the way you bite.
Overbite.
Yeah, something the way the teeth move around, and from gum disease, the bite changes. And sometimes, if you look in the mouth, you see the gums seem to be pulling away from the teeth.
Okay.
Those are all classic
I guess you can see
signs.
your bottom teeth almost down to the bottom with just a
Well,
tiny,
you can
tiny
see
bit
that the
of-
root of the teeth, where the root is in the bone, but when the gums start to pull away from the teeth, you can actually see like pockets around the teeth, and it doesn't look good.
Okay.
Now, some people have no signs and symptoms at all, and that's the tough cases. They have no bad breath, they have no bleeding
Okay.
gums, but they still have advanced disease. And you really, a clever dentist will find it still, though.
I bet you're a clever dentist. You look like one.
Well,
You seem to be someone who's very interested in what he does.
well, before you do any kind of dental work, really, you have to make sure the patient does not have gum disease, because that's the foundation of the mouth. If you're going to do dental work on somebody and they have gum disease, it will all fall apart.
The whole thing won't work then.
Correct.
Oh.
Because the patient can end up losing their teeth.
It will, and all the money they put into it's going to just be gone down the toilet.
And then you'll have an angry patient.